On behalf of everyone, my name is Dr. Scott Stoll, co-founder of the Plantrition Project. And I just want to welcome you this afternoon. We're going to take about 30 minutes just as an overview to do. I have a short presentation to talk about food as medicine, and I've actually woven in some slides today to help explain how obesity and COVID are related to severe outcomes. And again, pointing back to the power of food to prevent and suspend severe complications from COVID. I'm going to try to bring this in and land it about 30 minutes from now so that we can take a good 30 minutes for Q&A. If you will note at the bottom of your screen, there's a chat icon. Feel free to input your questions there. And Tom Dunham will be our moderator today, reviewing those questions. And we'll try to get through as many questions as we possibly can in our short time together. So I want to welcome you, and so glad you're here. You know, I started this health journey myself about 18 years ago when I saw that my patients' lives were being impacted by their lifestyle choices. They would commonly tell me that they were falling apart, and they thought it was the inevitable consequence of aging. And one day there was a woman sitting on my exam table who told me that she was falling apart, and I simply asked her what that meant. And she shared with me that the falling apart was a marriage that was falling apart because her husband was burdened and tired from taking care of her. They were facing financial bankruptcy. She couldn't attend social activities or church, wasn't able to travel to see her grandchildren. And so I realized in that moment that all of the degenerative lifestyle related diseases that were so common in my practice were not just diseases with a name, list of pathophysiology and medications to manage them. This was a serious threat to the very quality and the essence of life for my patients. So it set me on a personal learning journey where I really spent time trying to understand where disease comes from, and to also looking for any keys that would help me to understand if those diseases are actually reversible, not just preventable, but in the throes of disease, can somebody actually get well? And it finally led me to the food on our plate as the most powerful influencer of our health or disease process, and the most powerful intervention for reversing those same diseases. So I started to use my prescription pad to write breakfast, lunch, and dinner and smoothie recipes, and saw incredible transformations in my patients' lives. And that transformation spread throughout my office and the local community. And I really discovered that a whole food plant-based diet is one of the most influential and powerful choices that we can choose and implement in our lives on a daily basis. We shortly thereafter started a not-for-profit to educate healthcare practitioners about the power of plants and to empower and equip and enable them to utilize the same information in their practices and transform patients. And all of that points to the first slide, which is the conference that we're hosting, the virtual conference, which is a conference designed for healthcare practitioners, but is open to anybody that might be interested in learning more and digging down into the deeper science of how food interfaces with our cells and brings forth health. In my research, I discovered that our food system has changed more radically than we can imagine. And this was a comparison here from USDA data looking at foods from 1909 to 2007. And we can see that sugar and sweeteners have gone up more than 135 pounds per person per year. We've added 70 pounds of oil, 100 plus pounds of additional meat, 30 pounds of cheese, and about 500 calories to our average consumption. This also includes 53 gallons of soft drinks, which is about the same volume as a bathtub and a half full of soda. And so it's been a slow evolution. It's been an evolution of convenience, of hyper palatability, of delicious food, and the seeking of that perfect culinary experience. And as we have done that as a culture and now a world, we have seen a dramatic shift in the health of our populations because of the diseases related to those lifestyle choices. And so globally, for decades now, we've read about an obesity crisis impacting healthcare, impacting individuals, costing the world trillions of dollars, with now more than 2 billion people worldwide noted to be overweight or obese. But despite headlines, despite extensive articles in our media and television shows on obesity, the world continues to get heavier because the culture has not changed. We still live steeped in this culture of hyper-palatable, calorie-dense, unhealthy foods that make up more than 3/4 of our daily consumption. And so it's not really an obesity crisis. Yes, we do have a crisis of people that are overweight and obese globally, but it really comes down to a crisis of lifestyle choices. And just like the frog in the pot where the water is turned up and the frog doesn't realize he is boiling, so too in our culture over the last 100 years, as we have slowly turned the rheostat of lifestyle in the direction of more and more unhealthy lifestyle choices, more hyperpalatable, calorie-dense, inflammatory driving foods, more in the direction of more screen time, less activity, more stress, more disrupted sleep schedules. We have a crisis of lifestyle today. And so the solution is going to be turning that rheostat back toward those 1900s lifestyles when we ate predominantly whole food plant-based diets, were active, got more sleep and less stress. But the research is showing that diet is the #1 cause of both death and disability. The study from JAMA 2013 evaluated the risk factors related to deaths and disability and found that dietary risks, not too little, but too much of the unhealthy foods, is the primary risk of death and disability. And yet, very few in the medical industry are talking about this #1 risk. In fact, there's a lot of confusion in this area, both in the internet and in healthcare, with a wide variety of diets that are recommended. But we know that it goes back to that primary solution of trending toward more and more whole food, plant-based foods on the plate. Healthcare and researchers are starting to wake up. Studies like this from JAMA in 2017, the conclusion was our findings showed the increased intake of certain foods, those hyperpalatable, calorie-dense, inflammatory driving foods, and not enough of others, whole plant foods, was associated with nearly half of all deaths in the US due to heart disease, stroke, and diabetes. And it's easy to quickly read something like this and say, wow, that makes sense. But when we begin to realize half of all deaths, that's half of our family members that would die due to a lifestyle disease, half of those deaths are preventable and in many cases reversible. And we can maintain those lives that we value around us and help them to have a long, healthy life. So it's a profound statement that half of all the deaths are preventable. And in many cases, half of those deaths can be avoided with a strong lifestyle intervention. And as we've seen with the coronavirus pandemic in 2020, 90% of the people or adults hospitalized with coronavirus have one or more of the underlying conditions: hypertension, obesity, chronic lung disease, diabetes, and cardiovascular disease. And the vast majority of these are related to lifestyle choices. So, we don't have the greater information on this, but for those with a healthy lifestyle, I would be curious to understand how many of those have actually been hospitalized. And I'm hoping that in the months that come, we'll be able to do some more retrospective and maybe prospective studies to identify the impact of having a healthy whole food plant-based lifestyle and the risk of coronavirus. But we can see even here that with obesity, 48.3% of the hospitalizations were related to obesity. And we'll talk about that just briefly in a minute. But these are lifestyle related diseases, again, impacting the burden on healthcare through a pandemic like coronavirus. We also see, and there's more and more research coming out in this area, that 30% of hospital patients develop severe disease with progressive lung damage. And it's in part owing to an overreactive inflammatory response. We've heard in the news this idea of a cytokine storm, and cytokines are the chemical inflammatory response to an insult or an injury. And in this case, the cytokines are things like TNF alpha, IL-1 beta, IL-6. These are intense chemical reactions that are released into the body with the intention of fighting the infection. However, an overreaction of the inflammation can actually begin to damage tissue, and that's what we're finding with coronavirus. That the coronavirus comes in through the airways and attaches to the ACE2 receptor. The ACE2 then goes directly to the blood vessels, the endothelium, that very delicate lining on the 60,000 miles of blood vessels inside of our body. And it injures the endothelium. And so the pathology studies are showing that one of the first points of injury and inflammation in coronavirus patients is the endothelium. And it actually causes something called an endotheliitis. Once that happens, it activates coagulation pathways. This is one of the reasons that we're seeing more and more patients with blood clots in a variety of regions, including the lungs. And then we see deregulated inflammatory cell infiltration, that the inflammatory cells, the white blood cells, begin infiltrating more and more tissues. It's also interesting to note that the ACE2 receptor is found in almost all of our organs. And so once the virus is present, it can bind to the ACE2 receptors in the heart, the kidneys, the liver, and begin activating this systemic endotheliitis, inflammation in the blood vessels. And this is really critical because blood vessel health is a foundation for the maintenance of tissue or the degeneration of tissue. And Dr. William Lee at the Angiogenesis Foundation has documented this well and has identified that it is whole plant foods that optimize the health of the endothelium. So it's perhaps one other really excellent benefit for eating a whole food plant-based diet in this coronavirus pandemic is you're optimizing the health of the endothelium and downregulating or decreasing the potential impact of coronavirus damaging that delicate but invaluable single cell layer inside the blood vessels. So all of this just tells us that healing is a matter of time, but sometimes it's also a matter of opportunity, and that food is really never neutral. Whatever we put into our bodies within 4 hours is having an impact in our bodies. Within 2 hours, there's measurable inflammatory changes within the body based upon eating something that's high in saturated fat, like a sausage egg McMuffin. We also can identify that within several hours of eating something like broccoli, it's mobilizing the mesenchymal stem cells out of the bone marrow to begin healing and restoring musculoskeletal tissue. So our food is working in a dynamic way with our body. It's this ebb and flow of the food that we chew and swallow going into our stomach and beginning to interface with our cells in this beautiful symphony that plays out day by day when we're making healthy choices. Some other research that shows that this idea that food is never neutral and helps to clarify even that a healthy plant-based diet is different than an unhealthy plant-based diet. This was published in the Journal of the American College of Cardiology in 2017, where they looked at the risk ratios for people eating a healthy plant-based diet in the red, an unhealthy plant-based diet in the gray, and a plant-based diet. And we can see it first on the slide on the left, that we see that there's a greater risk reduction for heart disease with a healthy plant-based diet than just a regular plant-based diet. And those that are eating an unhealthy plant-based diet. So this would include, lots of processed grains and white flours, things like bagels, chips, and bread, lots of perhaps oil-based foods, processed foods, those types of foods. If you're eating the majority of your diet from those foods, we actually see an increased risk of heart disease. On the right, we see a comparison to an animal-based diet, a less healthy plant-based diet and a healthy plant-based diet. And we see that the real risk reduction comes in with a healthy plant-based diet. But both an animal and a less healthy plant-based diet can have a similar risk ratio for heart disease. Similarly, in type 2 diabetes, we see that those people that are eating a healthy plant-based diet in the green have a risk reduction of type 2 diabetes versus those that are eating an unhealthy plant-based diet. So again, the food is never neutral. And finally, this was a really interesting study where they looked at a comparison between high quality plant-based diet versus the consumption of more low quality plant-based diet. And they looked at HSCRP, high sensitivity C-reactive protein, a measure of acute inflammation over a 2-week period of time in 2 human trials. So the high quality diet consisted of the darker greens, darker berries, darker vegetables, the low quality, the whiter vegetables or fruits. And we see that over the course of 2 weeks, the population that was eating a high antioxidant, high quality diet had a significant reduction in inflammation, and those that were eating a lower quality diet saw a rise in their CRP, a rise in total body inflammation. And this can be important, especially as we talk about the pandemic and coronavirus, but a higher degree of inflammation, higher sensitized inflammatory system may contribute to greater susceptibility to that cytokine storm and damage to the endothelium. So in short, the solution is this beautiful whole food plant-based diet with a wide array of colors and flavors. As I work with many patients and we start talking through this process, it seems like such a big challenge to move from where they are on a Western diet to including whole plant foods in their diet. And it seems to them at the outset that it's not going to be as flavorful. But I always tell them that, as their taste buds begin to adapt through neuroadaptation over a couple of weeks, that they will begin to appreciate the distinct and unique flavors of a beautiful blueberry or a pomegranate, the different flavors of beans and grains, and the mixtures of all of those things with fresh herbs and spices, and that you're actually expanding the palette of tastes that you can experience on a daily basis, far beyond the Westernized diet. And as they move along that pathway, they see tremendous shifts in their taste buds and in their health as we walk that out together. I just want to share a brief story of a good friend of mine who experienced amazing disease reversal. And that's really what got me interested in this area 18 years ago, was looking for options to reverse disease, not just to have a healthier diet or to feel a little bit better, not just to lose weight. I was actually looking to intervene and help my patients that were fighting disease and seeing their lives come undone because of the manifestation of that disease. So this is a good friend of mine, Marcy Madrid, and her husband, Carlos, who live in Midland, Texas. Marcy is now the Vice President for Population Health at Midland, Texas. But in 2015, Marcy received the diagnosis of multiple sclerosis after suffering from diffuse numbness and tingling, weakness in her legs, and extreme fatigue. She went through the normal channels like most patients do, was seen by a neurologist, confirmed the diagnosis, and then was prescribed one of the disease-modifying drugs. She had lots of side effects from the first drug, went through the second, third, and was not able to find a repertoire of medications that minimized her symptoms without significant side effects, including fatigue. And Marcy would describe that she would barely make it through her workday, come home, collapse on the couch without enough energy to interact with her family. And she felt like she was just barely hanging on to survive. We had an opportunity to visit with Marcy through my work at Midland, Texas, and Dr. Staten Autry, who's a cardiothoracic surgeon at the hospital. We worked with her, and she changed her diet to a whole food plant-based diet, made lifestyle changes, and within 6 months saw incredible transformation. These are MRIs of her cervical spine, her neck, and surrounded by the white, and the first slide on the left is her spinal cord. And if you look at the spinal cord, you can begin to see the inflammatory lesions inside of her spinal cord that were contributing to all of the numbness and weakness in her legs. 6 months later, the MRI was repeated, and we can see in her cervical cord almost normal tissue with no inflammation along that cervical spinal cord. Similarly, in her MRI of her brain, there's a lesion here in the kind of top right corner around the ventricle, periventricular lesion of her brain, with showing lots of inflammation as her immune system is actually attacking the brain cells, the neurons here. 6 months later, the scan was repeated, and we see resolution of that lesion. Her neurologist, one of the top neurologists in the region in Dallas, had never seen this before and was so excited about what he saw that he's actually pursuing research in this area and now advocates for the benefits of a whole food plant-based diet to assist his patients with multiple sclerosis. But it's not just the physical benefits that are exciting about plant-based diet. Because all of these things are associated with unhealthy lifestyles, the cost of managing these diseases has really impacted healthcare. And there's some innovative healthcare systems that are recognizing the importance of beginning to address the underlying causes and reversing disease and the cost benefits, or the return on investment for investing in programs like that. This is Dr. David Feinberg, previous CEO of Geisinger Health, which is just kind of up north from where I live here in Pennsylvania. And he made this statement, which I think is really true. And I wish more healthcare leaders understood this. He said, we should be investing in people and processes, not hospitals. It's not about building more hospitals, more outpatient clinics, more MRI scanners, more surgical suites to manage the disease burden that we're facing. It's about investing in people and processes that have a vision for turning that rheostat down, for dialing things back by intervening at the root cause of lifestyle. And so they did. They created the Food Pharmacy, which is a partnership with local food banks and grocery stores. And they created an opportunity for people that have food insecurity and significant diseases related to lifestyle, like type 2 diabetes, to engage with a team that includes registered dietitians, nurses, physician, health coach, and a pharmacist to make a significant shift in their lifestyle through whole plant foods and begin to see an improvement in their condition. They did a study on 37 patients to test their pilot, and they identified patients that had hemoglobin A1Cs of 9.6 on average. And they saw that after 12 months of intervention, the hemoglobin A1Cs had reduced to 7.5, which corresponds to a 40% decrease in the risk of death and serious consequences just in a year's time. Importantly, they saw mean healthcare costs decrease by 80% from essentially $240,000 per member per year, based upon claims data for that group of patients, to only $48,000 per member per year. And the program cost about $2,000 to $2,500 per patient. So it's an incredible return on financial investment and an even greater return on investment for the life quality years that were restored. As we step out and we look again beyond even healthcare and the cost of healthcare in America, the types of food that we're putting on our plate are having a profound impact on the resources that we are stewarding as the adults for our future generations. In June of 2018, the largest study to date, looking at more than 38,700 farms from 119 countries that represented essentially 90% of the food that we eat. They found that more than 80% of the farmland today in those 119 countries is used for the production of livestock. And remarkably, that is producing just 18% of the food calories and 37% of the protein. And on the negative side, we see that it's also producing 58% of the greenhouse gas emission, it's contributing to significant water pollution, air pollution, and fresh groundwater withdrawals. And so we are depleting important resources, contaminating other important resources, and all of that for a very small food production. So we have to change the types of food that we're growing. We have to change the way we are growing the food. And when we do that, we can actually begin regenerating these resources for the children that we are all entrusting the future of the world to. In another large study, looked from the Proceedings of the National Academy of Sciences, looking at the analysis and evaluation of health and climate change, we can see in the graph here that as people moved from vegetarian to vegan, there were significant improvements in the economic value as well as the value of life benefits. And it's estimated based on the review of 95 studies that as people moved more and more to a vegan diet, a whole food plant-based diet, we could save 8 million lives per year and 129 million life years per year. There would be an estimated reduction in healthcare costs of 1.5 trillion and a 70% reduction in greenhouse production, simply by shifting our plates over to a really enjoyable, full, delicious plate of whole plant foods, spiced and prepared to bring delight to our palate and our taste buds, as well as to ourselves. So just in conclusion, as we kind of pull this together, I just wanted to share some things directly to improve your immune system and some foods that are important to add in on a regular basis to enhance your body's ability to fight infections. So the first, as we know, it's eat a wide variety of vegetables, and even for many of us on a plant-based diet, because we get busy and we develop comfortable patterns, the variety and the different quality of our foods can begin to narrow over time. We can sometimes become myopic around the food that we're eating. And so it's always good to kind of step back and say, well, what else can I add into my diet that has colors that I'm not typically eating? You know, if we're not getting enough reds, we can add in red peppers. We can add in more tomatoes with lycopene. If we're not getting enough greens, we can add in some microgreens, dark greens, or leafy greens. If we need more yellows, we can add in, you know, citrus fruits. We can add in papaya for more of an orange or yellow. Excuse me. But we can begin to add in those higher quality type foods. We know that adding in more dark leafy greens and colored vegetables increases the beta carotene content in our diet, which has been directly tied to enhancing your immune system. Vitamins like C and E also improve the body's ability to fight infections. And adding in, you know, a variety of dark fruits improves your body's immune system and reduces inflammation. Mushrooms are really important and often forgotten because of the different tastes of mushrooms and some of the lack of understanding in how to prepare mushrooms. But mushrooms really enhance your immune system's ability, not only to fight infections, they've been shown to increase the body's antimicrobial activity, ability to fight viruses and bacteria. They have an anti-neoplastic effect. They actually will stop the growth of cancers, cut off the blood vessel growth to cancers, and also kill some cancer cells. And they boost the natural killer cells, those cells that actually go out and find bacteria and viruses and chew them up like Pac-Man. And so for lots of reasons, eating maitake and shiitake and a wide variety of mushrooms can be very helpful. There are even great mushrooms like trumpet mushrooms that when you cut them up, they have a nice meaty flavor and can be added to a variety of foods to enhance kind of the texture and flavor of food. So I just encourage you to find more ways to include mushrooms in your diet. I actually have a son that really doesn't like to eat mushrooms. And so we will blend those up and throw those in the food into a stew, a soup. And he doesn't know they're there, but he's still getting the exposure of mushrooms. Herbs and spices are also a powerful way to enhance your immune system. And the auric value, the ability of the food to reduce inflammation, the oxidative capacity of those foods is much higher in these herbs and spices than it would be in even fruits and vegetables. So adding in a variety of herbs and spices, from garlic to turmeric to ginger, allspice, any of those that we can add in, paprika, will greatly enhance the nutritional quality of your diet and improve your body's ability to fight infections and reduce its inflammatory level. Beans and lentils strengthen your immune system in multiple ways. One of the most important ways are the resistant starches in the beans that are broken down by the microbiome to produce a wide array of short-chain fatty acids like propionic acid and butyric acid. Butyric acid has an amazing impact on the body. It boosts the immune system. It turns off a master switch of inflammation, NF-kappa beta, and enhances the microbiome's ability to fight infections. In fact, it's estimated that 75% of the health of the immune system is based upon the health of the microbiome. Activity also boosts the immune system and is very important. We also know activity boosts blood vessel growth. It causes neurogenesis, or the growth of new brain cells. Improves the health of the endothelium, again pointing back to our earlier conversation on the impact of coronavirus on the thin layer of blood vessels, in a thin layer of cells inside of our blood vessels. So adding in activity is really important, and it can be just doing anything you like for a minimum of 30 minutes a day, but weave that in somewhere in your daily activity. Sleep is really critical for the immune system, and during the deep sleep, our body regenerates the immune system. So it's critical to get between 7 and 8 hours of sleep per night, and to practice good sleep hygiene. And finally, stress can significantly impact the immune system through a multiplied mechanism of action, including the release of cortisol, which begins to disrupt the microbiome. So as we carry stress, and stress can come in a lot of different forms, from relational to financial, but it can also be fear-based. And so, as I like to often recommend, during this season where the news is constantly changing, the news is usually fear-based, it's better to watch less news and to maintain more of a joyful, peaceful spirit than to be overwhelmed by the fear that is in the media, because that has a direct impact on your body. It's the cortisol response and your immunity. And so if nothing else, just turn off the TV, go for a walk, do something peaceful for your own health and protection. And so I also like to just point out that, there is a very powerful regenerative potential for a plate that is built upon plant-based foods. And, it's not just your individual cells, your general health, the health of our family members, our communities. It is a comprehensive expansion into the world, the entire world, this food web that's all connected to what we put on our plates every single day. And so whether somebody's eating 25% whole food plant-based or 50%, the encouragement is the more that you move along this pathway, the healthier your body becomes. And the more that more of us move along this same pathway, the healthier our world will become. The more we will begin regenerating those important and critical resources like air and water and topsoil. It's a comprehensive regenerative impact. And the good news is that it's really the power of our plate that allows us to transform the world around us. We get to enjoy delicious meals that nourish our bodies, that give us vitality and energy, that help to give mental clarity on a daily basis. And as we're making those choices, we're investing in good foods, we're investing in farmers that have a vision for a greater future, we're impacting their lives, the soil, the stewardship, the resources. There becomes more money that's freed up in healthcare to actually help people that need help and can't afford it. So it's a really exciting endeavor, I think, for all of us to think about the totality of the regenerative potential for the food that we're putting on our plates every day. So as we transition again to Q&A, I just wanted to highlight the virtual conference. If you have any interest in the International Plant-Based Nutrition Healthcare Conference, you can visit our website, pbnhc.com, for more details. It's September 11th through September 14th. And we have brought in some of the best speakers in healthcare to dive deep into the different silos of healthcare and the power of plants to begin transforming the variety of disease states. It's also designed to help equip and empower healthcare providers to implement nutrition inside of their practices. And we have more than 20 CME hours associated with the conference. So I hope to see you there this year. Please join us. If you have any questions, please feel free to contact us at the Plantrition Project. So with that, I'm going to transition to, I'll stop my screen share and transition to some Q&A. And Tom's going to help us as the moderator. So Tom, take it away.
Okay, Scott, thanks so much. That was terrific. Assume everyone, can you hear me? Thumbs up if you can hear me. Great. So a couple quick things. Let's start. We had a couple questions regarding one of your slides. Hold on one second. Sorry, my Outlook is chiming. We had a couple questions about one of your slides where you had you had a list of foods, and one of the questions was, why are apples, pears, bananas considered low quality foods? And also, what exactly does low quality mean? I'm sure low quality means it's probably on a high quality scale. It might be on the lower end of a high quality scale, but what did that chart mean when it talked about apples, pears, bananas being a little bit lower quality? And again, what does that mean in the grand scheme of things versus other types of foods, which we know are not, very good for us?
So that slide is really just to emphasize the point that as we eat more foods that have higher phytochemical antioxidant content, it causes a greater reduction in inflammation in our body. So, apples and pears, potatoes are all good plants, and I include them in my diet. And they're just saying that they have lower amounts of phytochemicals compared to those darker colored fruits and vegetables. And so it's not a indictment against eating lighter colored fruits and vegetables. They're important in different ways and add benefit to our diet through the exposure to different phytochemicals. Like even in an apple skin, there's wonderful quercetin, which helps to heal the junction between those little cells in the gut and helps to prevent leaky gut syndrome. And so yes, they all have benefit. It's just a reminder for all of us to make sure that we're including lots of dark colored greens and berries in our diet to have the most significant impact for the health of our cells. That's a good question. Thank you for asking that. Important clarification.
Great. Thanks, Doug. So this question came in: are there certain foods that should be emphasized or de-emphasized to help improve overall immunity of cancer patients undergoing chemotherapy, et cetera?
Yes, and actually, they have done some very interesting studies, and I was just reading this today about the power of mushrooms to assist in be kind of partnered with chemotherapy, not only reducing some of the side effects of chemotherapy, but enhancing the impact of the chemotherapy and more rapidly killing the cancer cells. There are some small studies that show the benefits of reducing side effects of concurrent treatment with chemotherapy and the utilization of a plant-based diet. People tend to do better with fewer side effects. We also know that there are some very interesting studies in low-grade esophageal cancer. Eating 1.5 pounds of strawberries per day, there was a significant, greater than 70% reduction in the cancer for those patients that were eating 1.5 pounds of strawberries. So we do need more of these interventional trials to gain more clarity on which foods are most important. But again, it really appears from what we know now that by adding these foods that are high in antioxidants, the dark greens, the dark berries, and things like mushrooms and spices that really enhance the immune system, things like turmeric and ginger, they have a direct impact on cancer. We also know from Dr. William Lee's research at the Angiogenesis Foundation that, again, the whole plant diet, and you can find the information on his website, angiogenesisfoundation.org, that those foods actually help to kill the blood vessels that would be growing to a tumor. So as a tumor is growing, it secretes chemicals onto the blood vessel that cause that blood vessel to grow up into the cancer cell, thus providing like a 4-lane highway of nutrition to that cell so that it can rapidly grow and expand, but also giving it an off-ramp back out into the body to metastasize. And so the types of food, these beautiful plant-based foods, actually normalize the angiogenesis process, the growth of blood vessels, and begin to kill off those blood vessels growing to those cancers, rendering them essentially harmless if they can't metastasize or grow. And so in those ways, there are lots of mechanisms by which plants will dramatically help not only prevent, but combat cancer cells.
Okay, next question. It's funny, Scott, we've been working together so long. I know the answer to most of these questions now, so I can I feel pretty good about myself, but this is always a popular one. Let's start with, this is tricky. Are avocados and nuts bad for arterial function? And I know that's, there's some research on both sides, and we've tried to explain that before. And I think you have a really good explanation for that. So let's start with that. And then I have another follow-up question to that regarding omega-3 to omega-6 ratio.
Okay.
I'll ask that one.
Sure. So I think I'll address it from a couple of standpoints. Number one, the idea of calorie density is really important in weight management. And calorie density was done by Dr. Barbara Rolls at Penn State University. And she identified that for people eating essentially a diet around 600 calories per pound, they could eat nearly unlimited amounts of food and maintain a normal body weight. And so then they began to look at the calorie density of different foods, including plant foods, and found that almost all plant foods would fall above the 600 calorie per pound line. The only plant-based foods that begin to go below that would be nuts and seeds, avocado, dried fruits, and I don't even consider these a plant, but oils are sometimes people think of those as a plant-based food. So those are the nuts, seeds, dried fruits, avocado, are below that line and can be between 800 and 1,500 calories per pound. So just simply from a weight management idea, nuts, seeds, and avocados should always be consumed in very small amounts, occasionally, and usually as a condiment. And that's really important. Incidentally, oils on that scale are 4,000 calories per pound, whether it's olive oil, avocado oil, any of the flax oils. All oils are 4,000 calories per pound, 120 calories per tablespoon. And so it's very easy to lose control of the amount of oil that you're cooking with, including in your food, or eating with processed food. And it's very common for people to get 4 to 6 tablespoons of oil in their diet on a daily basis, or 500 to 750 calories additionally in their diet every day from simply oil. So the calorie density is important to put into context, the idea of nuts, seeds, and avocado. And there are studies that do show that adding a small amount of raw nuts and seeds into your diet 3 to 5 times per week, and a small amount is the amount that would fit in the palm of your hand for those of us with average palm-sized hands, just a few ounces as a condiment, like sprinkled on something. And there's significant benefit, cardiovascular health, reductions in cardiovascular risk in very large epidemiologic studies. The studies looking at the flow of the arteries and looking at the brachial index are varied in all of the responses to different oils, nuts, seeds, and avocados, and may not give us a really clear picture to make those kinds of judgments. For example, even in olive oil, there are studies that show olive oil can injure the endothelium or can help the endothelium. And so there's some confusion there. That's why I just like to clarify that oils are calorie dense and really should not be included in our diet, simply from a calorie density standpoint. When we look at, avocado, we're talking about, eating maybe a quarter of a slice every few days, cut up on a salad. Some of the fats, the polyunsaturated fats in avocado can actually enhance the absorption of phytochemicals and vitamins. And so including those small amounts in our food can be very beneficial. What we don't want to do is start eating, half an avocado a day because we say it's good for us and begin to experience some weight gain from that. Nuts and seeds, I tend to recommend more seeds than nuts because of the higher mineral content, higher omega-3 fatty acid content from chia, flaxseed, hemp seed, and greater benefit and less likelihood to overeat seeds versus nuts. And so I often will, in my personal diet, include some, chia flax or hemp seed on a salad or in a bowl of steel cutouts. So I hope that answers that kind of question. We need more research on some of these topics. There's a lot of good epidemiologic research. We don't have great large interventional trials. And I think that as we begin to explore some interventional trials, we'll gain some greater clarity on some of these questions.
Thanks, Scott. And so just on that note, so someone had a question about omega-3 to omega-6 ratios. And do you think that someone should automatically supplement omega-3s? So just some thoughts on that.
Yeah, these are really good questions, and I am struggling to keep them short because there's such a big backstory. The short story on omega-3 fatty acids is that the original trials that promoted omega-3 fatty acids in the reduction of heart disease, the DART-1 trials, were shown by the follow-up studies like the DART-2 trial to not be valid. But by that time, the media had taken off with this story. And so it's been such a common belief, like an urban myth, that omega-3s are good for the heart. In reality, the research shows that they really are not of great benefit. They may reduce inflammation. The ratio that we'll talk about in a minute is important. And there may be some importance long-term with risk of dementia. But more omega-3s in your diet does not necessarily reduce your risk of heart disease. And part of the reason is that when we look at the ratio of omega-6 to omega-3, the research shows that as we get closer to 2 to 1, even 3 to 1 in that ratio, that there is a significant reduction in all diseases. The challenge today is that the American diet, the westernized diet, which is now global, is between 18 and 40 omega-6s to 1 omega-3. And so the fallacy is that if we just add more omega-3s, we'll somehow make up the difference for all the omega-6s that we're eating, but we'll never catch up on that. And the other fallacy is to somehow think that our health is simply just this ratio of omega-6 to omega-3, forgetting that the reason that we're getting omega-6s in our diet are all the vegetable oils, processed foods, excess animal foods with heme iron and saturated fat and endotoxin and all these things that are causing cellular injury every time we eat them. And so, adding a little omega-3 is never going to compensate for the excessive damage that we have done to our body bite by bite. So the solution is to eat a whole food plant-based diet, which naturally brings that balance back to 2 to 1. And, the addition of foods in our diet, like flaxseed, chia seed, hemp seed, leafy greens, all enhance the omega-3 benefit. There's a small percent of the population that doesn't have the enzyme to convert the ALA to EPA. And so because that conversion is limited in some people, there's a percent of the population that may actually need to supplement their diet to prevent long-term cognitive decline. It's an easy blood test, and it's easy to do, just a simple fatty acid profile to see where you fall. So thanks. It was an excellent question. It's one that's always important to clarify for people.
Okay, so let's talk a little bit. All right, we have some time still. Let's talk a little bit about intermittent fasting. So someone asked, thoughts on spacing meals 5 hours between your two main meals. So I guess more generally, just a little, thoughts on intermittent fasting.
Yeah, so intermittent fasting, the research is really exciting on the benefits of intermittent fasting. And to date, the only intervention that has been proven to extend a lifestyle, extend lifespan, is fasting. And so we're beginning to understand the benefits of fasting. Fasting reduces overall inflammatory levels. It optimizes the microbiome. It enhances the body's ability to begin repairing itself. It naturally increases the reparative IGF-1 growth hormone. It normalizes the hormone balance. It boosts the immune system. So there's lots of benefits to fasting. Intermittent fasting has been shown to be an effective way to add fasting into a daily lifestyle. And there are a number of ways that people utilize intermittent fasting. There's some more extreme examples where people only eat for 4 hours and will not eat for 20 hours. They're more balanced, like 12-12, 16 and 8, or even 14 and 10, where people will eat for an 8-hour window and then not eat for 16 hours. And there are a lot of benefits in this kind of a pattern for eating. The research has shown that when people eat the same amount of calories in the morning versus the afternoon, their bodies metabolize those calories differently. And the calories consumed in the morning are less likely to cause weight gain versus the same amount of calories in the afternoon. So, 16 to 8 really pushes you to eat more of your calorie intake earlier in the day, stopping early in the afternoon and not eating until a late breakfast the next day. Research shows that it improves sleep. People have more deep wave sleep, better REM sleep during that period of time. The body is resting and not trying to digest food overnight. And that period of rest for the gut is really important, because more than 50% of our metabolism is addressing the processing of food and the digestion of food. So when we can shift that over and begin readjusting that allocation of energy to healing, repairing, restoring overnight, we see improvements in pain, improvements in body function, improvements in mental clarity. So it's a really good way to begin also reining in some emotional eating or challenges around food by just finishing up at dinner, sometimes brushing your teeth or have a cup of tea, and just don't go back into the kitchen. And as you do, it builds amazing personal self-discipline through that intermittent fasting. And I think it makes a healthy diet even more doable long-term.
Thank you, Scott. So you talked about endothelial cells earlier. What do you feel are, or what does the science show are the best foods for endothelial health and function? And therefore, and on the opposite end, maybe what are the worst foods for it?
Yeah, so that's a great question. I would refer you back to Will Lee's website. They have a very nice chart that really outlines the foods that optimize angiogenesis, but you could also probably guess what those foods are. Dark leafy greens really optimize angiogenesis. Pale colors, bok choy, arugula. Dark colored berries optimize angiogenesis. Blueberries, blackberries, raspberries, strawberries. Spices and herbs, garlic, onions, turmeric, ginger, basil, all optimize angiogenesis. Darker colored fruits, papaya, mango, enhance angiogenesis. And even green tea has been shown to optimize angiogenesis. So it's bathing that endothelial layer and all the phytochemicals that come in the multiplicity of colors that we find in a whole food plant-based diet. The research shows that, and you can already guess this too, the injury to the endothelium occurs from tobacco, caffeine, saturated fats, and sugar, toxins, all injure the endothelium. Excessive cortisol from stress can injure the endothelium. And actually the low level of inflammation from inactivity causes a mild injury to the endothelium. Even outside infections, H1N1 and coronavirus, again, as we talked about earlier, injure that endothelium. So there's this potential war going on right at that interface. And the more plants that we eat, the darker colored plants, the healthier that endothelium becomes.
So another common question we hear a lot is about oxalates and inflammation from too many green vegetables. Give us your thoughts on that. Sounds like an excuse not to eat your green vegetables, but yeah, I'd like to hear your thoughts on that.
So there are some vegetables that are higher in oxalates, like spinach. And for some people that may have a biochemical hindrance to processing oxalates or history of kidney stones, it may be beneficial to shift to lower oxalate greens. And so, from spinach to kale can provide a significant benefit. And so I do tend to recommend, and it's interesting, I tend to recommend lower oxalate foods, just simply because most of the lower oxalate foods tend to be more of the dark leafy greens, more of the berries, more of the herbs, spices, nuts, seeds, beans, lentils, chickpeas. So eating that kind of variety tends to be a low oxalate diet anyway. I've had patients that have had some struggles with oxalates because they had shifted and they were eating tremendous amounts of spinach, and that was causing an impact in their diet. And so, I think this just points out something that we need to always remember, that all of us are biochemically different in many ways. And, we have some that are, along that bell curve, where many of us are fairly similar biochemically, but it's still a curve. But there are also outliers on both ends of that biochemical difference. And on the far end, we have outliers that can almost do anything to their bodies. And these are the centenarians, those that are 100 years old, that say, I drank Coca-Cola, smoked cigars, and ate Snickers bars every single day, and that's why I'm so healthy, and you should do the same. But we also have, and any of those that have practiced medicine know this, we have other people that have very susceptible systems where small things make a big difference. And I think one of the mistakes that is often made, even in our diet world, is assuming that everybody responds to the same diet the same way, and that we can prescribe the same diet for everyone. In general, yes, a whole food plant-based diet is a great place to start for everyone, but we need to modify that based upon sensitivities and biochemical differences. And we even see this, in susceptibility to diseases. People from the Pacific Islands or other regions of the world, when they take on a westernized diet, they have a much more explosive impact of that diet in their bodies because of the epigenetic differences and the biochemical differences related to those epigenetic changes in the people groups. And so I think that, it'll be important as we go along to, eventually refine some of our dietary recommendations based upon the ethnicity, epigenetics, and biochemical differences to really optimize people's health. And maybe that fine tuning also really helps to improve the body's ability to fight and reverse disease.
Okay, thanks, Scott. So this one comes from a provider. Really good question here. So basically, says some of my IBS patients have significant issues transitioning to a plant-based diet. I tell them to go slowly, but I get asked about FODMAP often, which is low in beneficial fibers. What has worked for you for people with IBS in the transition? PS, FODMAP drives me crazy.
I couldn't agree more.
Yeah.
It drives me crazy too. And what we find with the FODMAP, which is a really limited diet, and it's really a diet that's designed to control symptoms, not heal the gut. And so what we find with people that are utilizing the FODMAP diet is they control their symptoms, but their dietary repertoire is so small, they can't eat anything. And if they go outside at all, it causes an intense inflammatory response in the gut because they've never solved the underlying problem, which is a dysfunctional microbiome, hyperpermeable and inflamed gut. And so I agree with you. I'm glad you said that. So what I have found working with my IBS patients is one, they're all different. And I have to start in different places in managing some of those patients. Some have a healthier microbiome and a lower inflammatory level, and I'm able to add in more high fiber foods or start with even more raw foods. And others have a really inflamed gut. And I have to start with, I've even started people just on like green juices because they could not tolerate the fiber even in cooked vegetables. So I've gone to like blended foods and juices to allow the gut to begin to heal, and focusing on improving the microbiome with some supplementation, including quercetin and glutamine, to begin healing that hyperpermeable gut lining and healing those tight junctions. And I found that, even sometimes a little bit of aloe will help the gut lining, but typically I use glutamine, quercetin, in some cases probiotics, to begin healing the gut lining, healing and restoring the microbiome. And then as the microbiome begins to heal, over the course of a month, I'll just add in very small amounts of cooked food, cooked very well. And then as they begin to tolerate some of the cooked vegetables, I'll have them cook them a little bit less. As they can tolerate that, I'll add in very small amounts of well-chewed raw greens. They chew it up into a paste and then swallow it. And then I find that over the course of time, and I will tell them that it takes sometimes 6 to 9 or 12 months for the gut to really heal, but it's a slow progression over that period of time. But to have the expectation that it takes a while to heal a gut, because I found that a lot of times they will be frustrated if they don't experience healing in the first month or two. I often explain to my patients that like IBS or IBD is like a severely skinned knee on the outside, to give a visual image, where the knee is raw and inflamed. And if you rub it with a little bit of anything rough or even a piece of sandpaper, it causes it to bleed again. But if you can visualize the same thing in the gut, that, eating foods that cause inflammation or even foods that have too much fiber will cause the gut to become inflamed, we just have to back off until the gut lining develops a little more resiliency and healing to tolerate the fibers. And as we do, it'll get healthier and healthier. And I also like to describe that the fiber eventually is important for feeding the bacteria that will begin multiplying and healing the gut. So we do need to work towards getting more fiber in the diet. There's a couple of wonderful gastroenterologists who've done a great job with this. Dr. Will Bushewitz, who's speaking at our conference this year, wrote a book called Fiber Fueled, which is excellent. And Dr. Angie Sadehi, who spoke at our conference last year, is an excellent gastroenterologist who's really tackling these challenges and helping people work through with a combination of the right diet, progressively increased some herbs and even some essential oils and supplements to help that gut lining heal. So that's all. It's kind of a summary in a very short period of time, but I hope that helps.
Yeah, thanks, Doc. That was great. And so on the inflammation point, so someone had a CRP question. Let's see. What are some reasons for CRP score between 1 and 3 if you're eating a mostly whole foods plant-based diet? And how does a CRP score, or does a CRP score affect your susceptibility to COVID?
Yeah, so there are some relationships between CRP and COVID that are beginning to, I guess, to clarify that, higher inflammatory levels may make you more susceptible. These are associations, loose associations at this point in time. So we can't conclusively say that it's a cause and effect, but there are associations. And so obviously, maintaining low inflammatory levels is important for not only COVID protection, maximization of your immune system, but lessening of risk of all diseases. And generally for people that are eating a whole food plant-based diet, their CRP levels will always be low. There are, in some instances, I've had patients that are eating a whole food plant-based diet, but they have some elevated CRP levels. And so a careful exploration of some of those causes, can reveal things like, a chronic arthritic joint or joint injury. It can reveal things like, food sensitivity that they had not identified. I was working with a patient and he was having still some persistent gut issues on a really clean whole food plant-based diet, a little elevated CRP. And we actually found that he was highly sensitive to turmeric, believe it or not. So we removed that from his diet, CRP went down, gut issues resolved. So again, it's that individualization of the diet. Even chronic stress, relational, financial, job stress, poor sleep can cause CRPs to go up. So it's again, looking at those other potential factors that can drive CRP. It's the comprehensive lifestyle approach, good sleep, low stress, exercise, good diet, cleaning that up that will lower CRP and improve your overall health.
Thanks, Doc. Let's see, a few more. Let's see, do you know of any data on ethically appropriate plant-based diet interventions and health outcomes in the Black communities? And I guess maybe off of that, we could talk about really any thoughts on any community, ethnic community or cultural community where the culture may be rooted in unhealthy food.
Yes, there are some studies that are coming out. And I can maybe put together a list of few of these after our call to send out. I know Dr. Kim Williams, a good friend of mine and our amazing editor-in-chief of the International Journal of Disease Reversal and Prevention, has been doing some studies with Black communities in Chicago, looking at the impact of a whole food plant-based diet intervention. I know there's some great studies that are being done on Hispanic populations and type 2 diabetes, showing that the significant benefit, as we all would guess, in utilizing that as a tool to assist those ethnic populations in reducing and mitigating the impacts of those lifestyle-related diseases on their health and health outcomes. It's a really important area. And I think that, as we begin to do more of these interventional trials, we can begin to more concretely describe the benefits in individual populations of a whole food plant-based diet. And the interventional trials are really important because interventional trials begin to drive meta-analyses, which begin to help shape policy. And, we have to work from the ground up with the research pyramid to begin eventually having enough research, strong enough research to shape those policy decisions. And so it's a really important question. The work is early and it's important, but there are some leaders like Dr. Kim Williams who are stepping in and really helping to define and describe the benefits in those populations.
Thank you, Doc. So let's see. We had a question regarding, let's see, if someone does not have an allergy to gluten or celiac, so no celiac disease, no gluten intolerance or anything like that, if someone eats gluten-containing grains or will gluten-containing grains cause an inflammation that might inhibit someone's ability to fight COVID? That's a difficult question, but any thoughts on that?
Well, I think, I can't answer directly about
Right.
the ability to fight COVID, but what we can say is that, it's not just the gluten that can cause kind of a gut reaction. Unfortunately, the way that wheat has been bred today, the carbohydrate to protein ratio has been kind of tipped upside down because the goal has been to breed wheat to shorter stalks that are actually easier to harvest. So through kind of like Mendelian genetics, identifying those kind of firmer, shorter stalk plants and breeding the wheat that's easier to harvest without really thinking about the health benefits of the head of wheat has created some challenges for the gut. But we also know that conventional wheat has typically been treated or sprayed with pesticides and herbicides 10 times before it's harvested. And in many places, they do a spray with an herbicide to kill the wheat before they harvest it because it makes it easier to harvest when it's dry. And so for lots of people, I've had a number of patients that didn't have celiac disease, but when they removed wheat from their diets, they felt much better. Their IBS symptoms resolved. And it's either because it's the type of wheat, it's exposure to herbicides, pesticides. We also know that the glyphosate, which is the most common herbicide that's used today, causes an injury to the microbiome. It doesn't injure human cells, but it does kill bacteria. And so it can, over time, disrupt the microbiome, and as a result, begin to cause irritable bowel symptoms. And so it's in multiple ways that the wheat can be an issue. And I guess, if we wanted to just make a potential hypothetical assumption that if we're, through that exposure to GMO wheat with the glyphosate injuring the endothelium, it's possible that that would impact the health of your immune system.
Thank you. Gosh, we got about 3 minutes here. So 2 more questions. This one's going to be quite hard and open-ended, but someone asked the question twice.
In 3 minutes.
All right. Can you reverse cancer through diet? How's that for a tough one?
Well, I'll simplify that and say that there are some diseases that when you get them, they are not as easily treatable or reversible with lifestyle and diet. And cancer is one of those diseases. Some respond very quickly and easily, like type 2 diabetes. Some require more intensive effort, like autoimmune diseases and heart disease. And others, like cancer, have a varied response. And so I think it's, because cancer is such an intense systemic challenge for the entire body, and so many systems are out of balance, diet in some cases, and we've all seen these examples, can do amazing things and seemingly reverse cancer and chew up tumors. I have had other patients that have been extremely diligent and with a very healthy diet, and were not able to reverse their cancer. So I always encourage people that, the more that you can be aggressive with a diet, if you have a history of cancer in your family, the better. And it's better to prevent cancer than be on the side of having to treat it with food. Obviously, if you have treatment, or if you have cancer, a whole food plant-based diet will dramatically improve the survivability and outcomes for people with cancer.
Okay, great. Thanks, Scott. So last one, actually real quick, someone asked, what was the name of the study that showed a 40% reduction with the food pharmacy? Was that just a study done at the hospital, or do you have
That was a pilot study that was done through Geisinger Health. You can find that. Feinberg was the author. You can find it on PubMed or Google Scholar. It was also written up in the Harvard Business Review as well.
Okay, great.
But yes.
Thank you. Okay, last question, and we'll end on this one. And this is you're real good with these. So encouragement. So how can we encourage our patients, friends, family to follow our lead? There's a lot of frustration out there with people that know this information. They know how effective it is. They lead by example, but sometimes getting people to follow their lead is difficult. Any thoughts on that?
Yeah, quite a few thoughts, and I'll just try to bring it home with these things. Number one, I always tell people lead with love. Sometimes, especially as clinicians, we like to lead with information. We think more information will bring faster change, but sometimes people are not ready for that information, and information does not always change people. So always lead with love, and as you said, lead with example. I think all humans have an innate ability to recognize hypocrisy. And if we're not living what we're speaking, then it's better not to advocate for something. So leading by example is really important, especially as a clinician recommending dietary changes. We lead with example. We can share things that we had last night for dinner, challenges that we've overcome, how we've worked with the children in our lives to make changes. And it becomes this very rich relational milieu that helps to bring about confidence as the person's making change, and an understanding by both people in that relationship of the truth and where they are, in an open conversation to lead them forward. So I think that's really important. I always encourage people, don't be discouraged. Even in my own family, it took my parents probably 8 years to finally get on board. And so family and close friends can sometimes take the longest to change. And so, for patients that I'm working with, I tell them just, don't say anything. If they ask questions, just say that this is what I'm doing for myself because I believe it's important. I value my health and I want to be healthy for you. And I said, let your personal change be the greatest testimony. And then when they ask, you give them a little bit of information. And as I say this, I'm not advocating for salt right here, but I always tell people, give people just enough salt to make them thirsty. So we give them a little bit of information to spark their curiosity, but we don't back up the dump truck and give them all of How Not to Die's salient points. Michael Greger's book, that can be overwhelming for people and it's too much. So just a little bit of salt to make them thirsty, let them come back and ask for more. I always remember as a clinician that I have a longitudinal, long-term relationship with my patient. And so I don't have to get them to completely adopt a whole food plant-based diet at the first visit or the second visit or the third visit. All I'm looking for is an opening to begin helping them make the next step. And then when they come in, they've made a successful step, a tiny step in the right direction, I help them make the next step. And all of the behavior change theory really shows that people making small steps in the direction of their goal are very successful. If we're really advocating to people to change it all in one day, it's much more challenging for people. With the caveat that sometimes people with severe disease do need to make a significant change to save their life in those moments, and just having that open conversation can be very helpful. I also remember that food is very powerful. And while I'm recommending, it's easy for me to recommend breakfast, lunch, and dinner, tell people what kind of food to eat, even how to prepare it. Food is so complex. It interacts with our emotions. We have a relationship with our food. We have a history with our food. We have cultural and traditions with our food. We use food to pacify pain. Food gathers people together, and so it's a part of natural acceptance in relationships. And so it's a very complicated element in people's lives, and that food web can be very integrated into their life. And so sometimes, we don't want to pull too hard because people will be fearful about losing a relationship or losing something or losing a coping mechanism. And so we just pull gently, and then if we find resistance, we help them solve the problem. And then we can help untangle some of the web of food around their lives in order to move them in the direction of being healthy. And I also like to just share that, I always describe to people that it's a joyful journey. Now, this is a journey that's going to only add abundance to your life. This is not sacrifice, deprivation. This is about abundance of energy, abundance of vitality, abundance of mental clarity, abundance of energy to pour into relationships, abundance of strength and vitality to achieve your goals and dreams and to travel. This is about a joyful and abundant relationship. So I hope that helps. Tried to summarize that in a few short minutes, but
thank you, Scott.
Insights. So I just want to take a minute, Tom, I'll turn it over to you to bring it home, but I just want to thank all of you for spending the afternoon with us today. And I just want to encourage each of you that, you carry a solution for people. You are a solution. And as each of us step out into the world and, interact with people and lead with love and share a solution when they need help and come alongside people with the support they need, we can see a radical transformation in a very, very short period of time as we all work together. So thanks. I hope you all have a wonderful afternoon, and blessings to all you and your families. Thank you.
Okay, well, that's it. Thank you so much, Scott. That was terrific. We've gotten a lot of great comments about the content and about your taking the time to answer all the questions. So great job on that. Again, we want to remind everybody that we're super thankful for our partnership with our friends at Plant-Based World, and we're excited that we have merged the healthcare track from the Plant-Based World Conference and Expo, which unfortunately was canceled due to the COVID pandemic. That was canceled back in June, but we were able to merge that with our conference in September, the virtual PBNHC, Plant-Based Nutrition Healthcare Conference. So we'd love to see you, like Scott said several times. If you're interested in taking a deeper dive into these topics, please feel free to join us. You can visit pbnhc.com, Plant-Based Nutrition Healthcare Conference, pbnhc.com if you'd like more information, or you can just email us at info@pbnhc.com or info@plantritionproject.org, and we'd be happy to answer any of your questions, and hope to quote unquote see you there in September. So with that, we'll sign off. Thanks so much, Scott. Everyone have a great day, and again, thanks for being with us.